Query number 99 from Bardoli, Gujarat. Not having guidance or knowledge to prepare customized consent form in local language. How to convince patient to understand and fill the form? Consent is never a filling of the form. You have that mindset from the hospital setup where you have provided a huge blank sheet, multiple sheets, and where you have to fill in the patient names, and you can say it is there. Dental treatment consents are customized. You need to understand that. I'll come to the local language part, but it is not about the written part. The written is just a procedural formality. It is more about the verbal part. You have to detail everything verbally first, including all the pros and the cons, including all the risks and benefits, including all the parallel treatment options, including the costing, including the pitfalls, including the risks of not getting the treatment done as well. Treatment options as well as not getting the treatment done as well. So once you do that verbal detailing part, you just mention that all these things will be in written and you have to sign that as well. If the patient is mentally in sync with your verbal conveying of the things, then the procedural formality is the signing is just a procedural formality. Now, coming to local language, the simple tip that I give is that one of the, you can say, toughest option is not the easy option. You can have a translator into your clinic, but the simple way is, I believe, I tell the patients to, you can say, put in something, you can say, or bring a neighbor, family member who understands English, and you convey those things in a local, you can say, in local language, and tell the same that they can read the form, and you can video record the session where you convey the same things in the local language. Ask for a prior permission, video record the session, and take a consent signature even in the English part, mentioning it very clearly that the patient was detailed. You have the video evidence of the same be conveyed in a local language, and the consent form still is in English. The translator is another option, but I believe this option, whichever it is needed in a very, you can say, count wise, it is needed very lesser. You can say, try different methods for the local language, but the local language sometimes can be a little fearful and a little, you can say, more, you can say, killing for the patient, I would say. It actually makes the patient fearful of the treatment to be done. So rather than going in for that, I suggest that you take the consents in English, because consent forms are the easiest to design in English. And you need to, when I take the consent workshop, I not only teach how to make forms, we make about 50 to 55 forms in that workshop. What are those forms? You need to be in there for the workshop to know that. And probably I'll be doing that in March or April. So, and I tell you the way also how to talk and how to convey the same to the patient as well. And this is the way you can be assured that the patient is supposed to follow that. So I hope I answered your query.